I'm excited to be back here for my care, to start my brand new life.
Amy VanDyken ruined from Craig Hospital, which will be her home for at least the next 2 to 3 months as she learns to live with her severe spinal cord injury that she suffered from that ATV accident now almost 2 weeks ago. She thanked her fans for supporting her.
I'm happy to be here. I'm thrilled. I'm relieved to be back in Colorado and at Craig Hospital, where I know that, you know, my second life is going to start, and we're going to rock and roll, and I'm going to be the best me that I can be.
Talk about positive. Amy's mom, Becky, said her daughter inspires her every day.
I know she'll just surprise everybody, and she'll accept all the challenges she has, and her and Tom are amazing.
But what is the realistic long-term outlook with this kind of severe injury? Let's get into that with Dr. Trevor Dyson-Hudson. He's the director of spinal cord injury research at the Kessler Foundation in New Jersey. Thanks for coming on.
Thank you very much for having me.
So in your estimation, with current technology, with the current treatments in place, will she walk again?
I don't know if I can comment on that really at this point, and I don't think anybody can comment on that. I think it's each injury is very unique, and I think it often comes to the individual and what's available at the time.
Certainly, it's got to help to have a positive outlook and have strength and determination. We've certainly seen that with Amy. But have you actually seen patients with those traits who do better than other patients with the same diagnosis?
Absolutely. I think attitude and outlook are one of the most important things, because the bottom line is you have what you have at that time, and you really need to make the most of it. And if you gain more, then you work with that. I mean, it's all about making the most of it. That's what rehabilitation is all about.
Have you seen patients with spinal cords that are severed in a similar place, this T1, T2 area on Amy VanDyken, that have been able to get mobility again?
It's difficult to say. I mean, I see that term used as severed, and not being exactly familiar with her case, I can't really comment on that. I mean, I have seen people who were giving grim prognosis in the beginning. Yeah. You know, one often hears tales of people being told you'll never walk again, etc. And these individuals do end up walking, and that could be walking whether on their own or through the use of some sort of assistive technology, like we currently have robotic exoskeletons that are starting to be used, and other things like that.
Yeah, exoskeleton, a high-tech exoskeleton that has helped paralyzed patients walk 7 million steps at close to 50 rehab centers throughout the world. That's pretty exciting, these wearable robots. What else is out there, this new technology? Because it sure looks like a field that's changing all the time.
Absolutely, and I think really people don't think about it, but it really starts with the wheelchair. You know, that is often the one device that we can give somebody, especially in the beginning, to help them get out of bed and become independent and mobile again. That at least gets them out, up, and doing rehab, back out in the community. And as they go along, then they may move on to walking if that's a goal of theirs, or they've got this device that at least gives them independence.
And now those wheelchairs are lighter than ever, which really helps. Tell us about the latest studies using therapies that may see stem cells regenerating. How do those work, and where are we as far as being able to use those to help somebody walk again?
Sure. Well, they're still in the early stages. They're in what's called the safety stages, in which, you know, they're being conducted in a small group of individuals to just assess their safety, because the last thing they want to do is make an injury worse. So there are a number of clinical trials that are starting up or going on across the country. For people who are interested, they can just go to clinicaltrials.gov and do a search for spinal cord injury and therapies, and a number of trials will come up there. But they usually target either regeneration or preventing damage that may occur during those early stages of spinal cord injury.
It's exciting stuff, and we certainly wish her the best. Dr. Trevor Dyson-Hudson, the Director of Spinal Cord Injury Research at the Kessler Foundation. Thanks again.
Thank you.
524 on 850 KOA.